Imagine this. You've just been told that a loved one is going to die in less than a year due to a terminal illness. You feel pain, fear, anger, sorrow. What's even worse is that with their type of illness, you know you'll have to watch them slowly deteriorate. They won't be able to do the things they love to do or even be the people they are anymore. Imagine, though, that there was an alternative to this painful deterioration. Well, with the Death with Dignity Act, there is an alternative. This law has been passed in Oregon, Vermont, and Washington. It allows mentally competent, terminally ill adults to voluntarily request and receive medication to hasten their deaths. The process for receiving this medication is as follows. The patient receiving the medication has to put in an oral request, wait at least 15 days before putting in a second oral request, then sign written requests. The patients may withdraw their requests at any time throughout the entire process. Patients must pass a mental health test and meet regularly with a counselor as well. When the time comes that the patients want to ingest the medication to hasten their death, they must take the medicine themselves. This law is extremely controversial, and there are many opinions on whether it is ethical or not. Different religious and political views influence how this issue is seen. Many fear that this law being passed will lead to a slippery slope when dealing with other illnesses or depression, but the act has existed more than 10 years in Oregon and nothing of the sort has come up yet. Some criticize the fact that someone would be willing to give up hope of a cure being found. However, it's very difficult for people to make opinions and judgments about this issue when they've never had to face being terminally ill. And despite all of these assumptions that the accessibility of these drugs makes people crazy, studies show that 36% of patients who received the drug never even consumed it. For many, the existence of this medication is simply reassuring. Whether this is ethical or not is a decision that cannot be made by anyone but the patient. However, the decision that can and should be made by the public is to legalize this self-administered drug. The Death with Dignity Act should be legalized, giving patients the choice of how to handle the fate given to them. Many terminally ill patients already choose to refuse their treatments, which ultimately leads to greater and longer suffering. Why can't they choose to receive this medication that has the same effect but preserves dignity? Even if the patient decides never to take the drug, this law's very existence brings people peace and lessens anxiety about what's going to happen after the illness worsens. So far, the 5 biggest concerns that patients have had when choosing to receive this medication are losing autonomy, being less able to engage in activities that make life enjoyable, loss of dignity, losing control of bodily functions, and being a burden on family, friends, or caregivers. And is this so hard to understand? What father wants to have to ask his son for help going to the bathroom because he is so ill? What self-driven person wants to be fed and constantly looked after by doctors and nurses? What adventurer wants to spend the rest of their life unable to get out of bed? What mother wants to hopelessly watch her children hide their pain and sorrow as they watch her die? Imagine you are the one who has been told that you only have 6 months to live. With this act, it is possible to die while still having your dignity, your independence, your joy, your sense of normalcy, and yourself. It's a very personal decision to make, and it's no one else's place to say that you should not be able to get these pills if you want them. Whether or not to take the pills is each patient's individual decision to make. And you'd have to take into account your own political views, religious beliefs, family, personality, and ambitions. This issue is so controversial because we each have our own beliefs based on our own stories. However, it can and should be agreed upon that despite the individual view of whether it's right or wrong to die with dignity, the patient should be able to access this medication, avoid slow and painful death, and make this decision for himself. To learn more, contribute, or join the conversation, go to www.deathwithdignity.org.